Hi. Last time I spoke about what is stroke. I just briefly defined what is it. So in this video, I'm going to tell you what are the symptoms of stroke. Stroke presents as acute weakness of limbs on one side. It's going to be the upper limb and the lower limb which is getting involved along with the facial involvement. Even the face becomes a little weaker. You would have seen that the patients with stroke can have a little deviation of the angle of mouth to one side. And of course the limbs are weak. The limb weakness is sometimes very trivial. They can just they can have movements, but again they can't make a proper gripping of the hand. Either that could be the only presentation, or sometimes the whole limb is so weak that they can't move the limbs at all. It's called a 0/5 power in our medical language. This apart, patients can have problem related to the vision. So the patient says that they can't see things clearly all of a sudden. So it could be just one half of the vision, it could be some kind of a blackening here and there, or it could be some kind of a fluctuating blackening of the visual field. So these things again, could be a manifestation of stroke, and it's important for us to pick that up. And the other presentation is difficulty in speaking. So speaking is a important part of stroke presentation. Most of the patients have difficulty in pronouncing the words correctly. We call that as slurring of speech. Sometimes they'll have only grammatical mistakes. They can't make a proper sentence. They can just speak in bits and pieces. They can't make the sentences clearly. Sometimes they'll have difficulty only pronouncing the names, the proper names. So there could be a grammatical mistake, naming difficulty. There could be some kind of a very gibberish language. Patients sometimes, they'll speak in a very different or a gibberish language you will not understand. Or sometimes when you ask a particular question, the patient may not be in a position to answer the questions correctly. They may speak something irrelevant. So any deviation from the normal language functions can again be a part of stroke. This apart, stroke can have problem like giddiness. They may fall down. They may have balance issues. Patients will say that all of a sudden I was not able to walk correctly. I was swaying onto one side, either right side, left side, or back side, or front for that matter. Or they may suddenly have so severe presentation of stroke that they may just fall down, they may have seizures, or even death. So stroke presents like this. So whenever somebody has these symptoms in front of you, you're seeing that somebody is having that kind of a presentation. Don't waste time. Bring the patient to the hospital as early as possible. You can save lives. Thank you.